one of the things that we see as what's ahead for the mental health field would be serving the highest risk. And I think all of the future, hopefully, is about looking at system change. How do we improve the way the mental health system works? How do we improve in connection with the healthcare system in general and with the community? So serving the highest risk people is a evolving change in terms of, rather than waiting for people just to show up, to say, let's figure out who are those people that really need help. And some of that's happened certainly already in some pieces. In fact, when some of the recession and the state and county cutbacks of funding, the Healthcare Foundation stepped in, and there was a grant to work with hospitals, with the frequent flyers in the hospital, to start outreaching to them and engaging them, convincing them to come into treatment. And it worked incredibly well. And the majority of the people who request help for mental health or addictions do not get help. I mean, it's upwards of 90% of the people who are addicted, who need help, don't get it. And well over 50% of people who need more traditional mental health services do not get services.
There are no doctors who specialize in that? Or
these people don't have insurance.
Okay.
Yeah, these people don't have insurance.
So nobody wants to serve.
And they're not on Medicaid. And while there are safety net providers, they typically, well, they are mostly, if not exclusively, physical health, almost totally physical health in terms of their focus. And so the ongoing treatment. You can get crisis services. What happens is with mental health and addictions, they go to the emergency room and they get crisis services, but that doesn't fix the problem. So that's a big concern, working on that. How do we do something? And it's actually, percentage-wise, it's a small example, but the mass shootings. People identify the fact that there are some of those shooters are people that clearly, they're usually young men, and they say, okay, there was something wrong with this person, and we know there was something wrong with them mentally, but we didn't know what to do, and they didn't want treatment. And again, the number of people who are mentally ill who actually kill somebody is incredibly small. But there's this copycat thing going on where I can get attention this way if I go out and do a mass shooting. And so there's certainly more of it, as we all know, than there used to be.